here today as nurses from Siaya because we had a strike last month and then we suspended this strike for 30 days. The 30 days elapsed. We did another strike notice to our employer. The employer never engaged us in any way. And then we decided now to down our tools officially as from yesterday. We are on this strike until further notice. The further notice means until the employer implements our agreement that we had last month. We have issues like the third-party deductions. Pesa zetu zinakatwa every month kulipa loan, insurance, SHA, and SACCOs. Unfortunately, this money is not being submitted to the relevant agencies. We are calling upon the government, county government of Siaya, to kindly remit this money so that we can get our services that we require from the banks. Our members cannot access loans anymore because the employer has not remitted the deductions. Our members here cannot seek for services using the SHA. We are calling upon the county government of Siaya to kindly remit these funds. We are also having issues with our employer on one thing. Last time when we had the conciliation process with the county government of Siaya, the county government of Siaya made it very clear that they were recruiting nurses to address the acute shortage of nurses as we brought it. And it also established for us that they were in the process of deploying. Suddenly, we are being told that the same nurses that Siaya County government had employed to cushion the shortages are being called ghost workers today. We have engaged our national office and we are going to address this matter, and we are calling upon the governor to intervene. We don't want scapegoats in this issue and to be addressed casually as they are, because we have our nurses who are currently at home and facilities have been closed down. And this issue is affecting the community of Siaya as a whole.
We are out on the street so that the public, we want the public to join us in this thing that it is the county government of Siaya striking against wananchi, against the citizens of Siaya County. The vital health system and health services has been compromised. We call upon the governor and the backstops with the governor to listen to the plight of Siaya County residents.
And I must say, I for one, feel pain what the people in the medical sector are going through. I feel pain, and I've acted for doctors and people in that profession when they were involved in strikes, and some of them arrested and prosecuted. Cases that be filed before the courts and appear for them. So I look at this thing with a lot of sympathy. And I want to say that the positions that I've taken at the Council of Governors on some of these issues would demonstrate that I have nothing but goodwill when it comes to the issues that are being raised. The first issue that they complained, they wrote to us when they were giving us a strike notice, majorly on 4 matters to which we gave responses. The first one was the question of remittance, or rather salary delays. As you know, the release of the exchequer from Treasury takes a long time. Even as we speak now, we got a Treasury release for the month of August last week. And before salaries can be paid and other bills be paid, you got to place your requests through the county, the control of budget, who examine and look at those requests. If there are salaries, they look at those, your payroll meticulously. If there are those who are not in IDTP and are paid manually, they scrutinize those papers. And there's a back and forth before they can approve. So one, there was a late exchequer release, and secondly, the approval from the controller of budget had taken a while. And in fact, the approval came today. We should have paid people their salaries at the end of last month, 30th of August. Now, we also have an arrangement with the Kenya Commercial Bank to enable us to pay our staff, and this enabled us to pay on the basis of the payroll, but we have to pay that amount from the Kenya Commercial Bank before we can get another facility. They cannot give us 2 months' salary to pay to our workers. So right now, the Kenya Commercial Bank could have helped, but unfortunately, we owed the money from the last month. And one of the things that the nurses were complaining about are third-party deductions, remittance of those third-party deductions. Now, sometimes when we are given this money by the Kenya Commercial Bank or any bank, they give you the net salary because they can only loan or give you a facility for so much. Say we cannot go beyond 250 million or 300 million. So that is also sometimes affected by the amount the bank can release to us. But the cause of this is the delay, one, by Treasury, and two, by the Office of the Controller of Budget. And right now, both the county executive member for finance and his chief officer are in Nairobi. They have been in Nairobi for the last 10 days. This is something we complain about in the Council of Governors all the time, that these processes and red tape and bureaucracy makes even the functioning of counties difficult when our officials have to follow things in Nairobi for too long. Then there was a question of the absorption of UHC nurses from temporary contract to permanent and pensionable terms. This is a matter before the Council of Governors. And we have to act together as a council. And one of the issues that we spelt out was that if we are to make this decision, the national government must give us that money to be able to pay the UHC nurses their money on permanent and pensionable terms. So this is a crisis that we have, that technically they are not our employees, they are delegated to us, but on account of resources that should come, strictly speaking, from the national government. But this is a matter in which the Council of Governors is unanimous that we have to handle this together, and we'll pay when the matter is resolved. And the only way it can be resolved is by national government availing those resources. And the Constitution says when you give a function, it must be followed by resources. And in this case, we don't have the resources. The third issue was the non-implementation of the SRC circular for the financial year 2024 and 2025. And again, the Council of Governors has taken a common position that there must be additional exchequer to enable us to pay those increased allowances. Because we got these ceilings, we have budgets which you can't exceed. Whenever you are requesting money from the Treasury, it must be in line with the budget. So if it shows that you're paying an allowance which is not budgeted and is not lawful, that may lead to a refusal to give you that money or that permission to pay. The question of the return to work formula and the negotiations of the CBA with the union. Now, again, the Council of Governors is taking the position that we cannot negotiate county by county. This can only be done globally. Counties using the Council of Governors as the vehicle and setting up with the membership or the official dome of the nurses union. So this, in a nutshell, are the areas where we are faced with problems with the nurses. And it's not an isolated case. I think you hear of this from county to county. Some counties, nurses went on strike 2 months ago. We were able to talk to our nurses, and gracefully they agreed to give us 30 days while we pursue this matter with the Council of Governors. I also agree that 30 days are over, but the ones which we can resolve, we can resolve, which is the issue number one, the payment of salaries and third-party deductions, which again, as I explained, the exchequer delay, but I've been assured by the county executive member for finance that they will remit the gross pay to our members of staff, of course excluding statutory deductions. So that's the explanation I can give. But we appeal to them to allow this matter to be resolved peacefully. Let's sit around the table at national level through the Council of Governors and their national officials, and locally, if we reach an understanding that as of today, their monies will be paid for the month of August, because I don't think we have any arrear except for the month of August. I also would want to appeal to the nurses to return to work immediately. Their work involves matters of life and death, and we need them. The people who visit our hospitals need them. So we appeal them to go to work.